Governor, two questions related to the Smart Health card. You mentioned swiping right for the booster shot. Thanks for mentioning that. Wanted to ask you specifically if there is any, sorry, wanted to ask specifically if there's any kind of glitch on that app that people have experienced so far, and how many, you said that there were a couple thousand that had downloaded that today. Are those new downloads because it was an upgrade to the previous Crush COVID app?
Right, so the Crush COVID, the base there stayed, and then they should go on though, I believe, right? They should go on, Andrea, and update it. But the 3,500 was, I was just told before I came over here that that was the count that is since the app opened up. So that's a good progress.
Now, people that maybe have gotten their vaccinations out of state, we've seen some people that those are not showing up for. Maybe they've gotten a booster in Rhode Island and those are showing up. Any ideas on how to address that? Maybe that's a question for you, Tom McCarthy.
Yeah, Tom, jump in, please.
Yeah, so, one of the challenges we've had is there's no national vaccine record database. So what we've tried to do is at least standardize the proof of vaccination. So if you don't have your card, this digital proof of vaccination will work across the country and internationally. So what you can do is, and we'll push the information out after this, but on our website, if you provide your proof of vaccination from out of state, or if you're a veteran and you received it through the Department of Defense, we'll add you to the Rhode Island database so that you can use this. But currently now, this captures everyone that's been vaccinated in Rhode Island and is in the Rhode Island database, so you'd have to be added.
All right, Brian?
Governor, what is the holdup with bringing in the National Guard? Massachusetts is doing it. I know you made the request of FEMA, but that doesn't seem to be anything imminent. Wouldn't the National Guard be an immediate help in the hospital?
Yeah, so we announced the FEMA application last week. We had also projected a time frame the first couple weeks of January. In conversations with the general today, I think that all options are open. I think that Massachusetts just made that announcement this morning. So, and we'll get the details of what they're doing. But our National Guard has stepped up in every situation. We talked about testing and also vaccination. We got them back in the loop on that as well. And we'll find what the capacity is, but all options are on the table, and that was the message that I asked the general today, well, how I should answer that question that would be asked, is that all options are available on the table, and we'll continue the conversations with them on an immediate basis.
And I know you mentioned expanding the rapid testing with the added site in Cranston and distributing the home test by the end of January. I think there's a lot of people who are trying to get tested this week for holiday gatherings. What do you say to the people who just can't get an appointment, can't get a home test, and are trying to take that step to have a safe gathering?
Let Tom answer that in terms of capacity so he can give people the correct information.
Sure. Yeah, I think a couple of things to be aware of. So, obviously over the last couple of weeks, that the outlook has changed pretty significantly. And no doubt, I know the president is actually probably speaking to it right now. The Omicron variant is presenting a unique challenge. And there's definitely going to be some challenges ahead in January and February. So with that, I think people should kind of reassess their risk when they're looking to go to holiday gatherings. We know Omicron is in Rhode Island. We know it represents about 73% of the new cases nationally, not quite there yet in Rhode Island that we've observed, but we know it's coming. And we know it has an impact on the protection from symptomatic infection, even if you're fully vaccinated, even if you have a booster. So I think people should continue to do the things that we know that work. Get tested if you can, and it's a finite resource. There's only so many tests and only so many appointments. Make sure you're vaccinated, make sure you're boosted. If you're at high risk, maybe you reassess your plans, but layering all those things is going to be critical. The mask wearing, everything we've talked about in the past. With regards to testing, so we want to make sure testing is as available and as accessible as possible ahead of the holidays and in light of all things Omicron. So as the governor shared, we're doing more testing now than we ever have in the past. And there's a couple of things that I wanted to talk about. One, those rapid tests give you results that day within a couple of hours. So you have a sense with a pretty high degree of confidence, if you're carrying or have COVID at the time. PCR is the gold standard, but the rapid antigen is a great test as well. With the PCR test, you know, as I shared last week, the challenge we're running into now is we have maxed out all of our lab capacity locally. And there's one very specific reason why. I'll talk really quickly about why we're there, but more importantly, what we're doing about it. You know, from a response perspective, what we've been asked to do, what we've been focused on, is first and foremost keeping Rhode Islanders alive and keeping them out of the hospital, and keeping students in school safely, and keeping businesses open safely. So with that, we prioritize our long-term care and our congregate care settings, then our K through 12, our school, our students, and our staff, and then the rest of the Rhode Islanders like you and I. So with that, you know, we found as Delta has continued to impact us over the winter that we have over 100 congregate care settings that are in kind of an outbreak response protocol, which is far more rigorous testing. And we know from our experience last year, those are some of our most vulnerable Rhode Islanders. So with our PCR tests, we've been prioritizing the results, so all of those are coming back in less than 2 days. Next is K through 12. Those are somewhere usually between 2 and 4 days. And for everyone else right now, it's about 3 to 5 with some outliers. The bottom line is that we have to get those back down. So as the governor shared, we're doing a few things to further expand testing. You're going to see more sites, more availability of rapid tests at all of our sites, and then those at-home kits that we can distribute to people, while we also bring on additional labs so that we can vastly expand our PCR capability and ensure that we're getting them back to everyone in less than 2 days.
So on the at-home tests, if somebody tests positive on the at-home test, what should they do? Should they, because they're not in the system, so to speak, as you would normally be if you're tested at a site. So what should you do, and what's kind of the protocol, and how do you
Sure.
keep track of those people?
Yeah, we have an intake process, and we'll have to get you the details afterwards here, but there's a phone number that you can call, notify us that you're positive, and then we'll connect you with our case investigation and contact tracing, and you'll go through the standard protocol at that point. But as always, if you test positive, begin to isolate, and then we'll make sure that we get that phone number out after this.
Right over here. Thanks. Governor, the nursing home industry came out yesterday and said that they're dealing with thousands of staffing shortages, and that the new staffing requirements that are going to go into place at the beginning of the year is going to make matters worse. So they're asking for a one-year moratorium on those requirements. Is that something you would support?
Yeah, so, and I've had the same conversations, meeting with the nursing home associations, and I know that that's one of their requests. I think that from a practical point of view, as I've said, there's 3 big issues that we're dealing with: staffing, staffing, and staffing. And in the healthcare area, it clearly is that space. So we would look at any options and work with the General Assembly leadership on developing those options. And that's certainly a discussion that we expect to continue with the healthcare, you know, the nursing homes, as well as the leadership in the General Assembly.
Thank you. Steve?
Governor, 2 things, if I may. The first is you mentioned opening 2 mass vaccination sites. Are these the same sites that were slated for closure at Saconaset and East Providence?
Yeah, I'll let Tom answer that one. He's got the logistics, but East Providence is staying open. When we were suggesting that might close when we were on the ramp down mode. Saconaset was scheduled to close, but we kept that open, and we're negotiating right now with the property owners. I believe that Middletown is going to be activated. You might want to just speak to that.
Sure,
Tom.
absolutely, Governor. Yeah, so as the governor shared, so Saconaset, we're still vaccinating there this week, and the plan is to even further expand operations there when we're looking at testing and treatment. Also looking in Providence, potentially the convention center, and then over on Aquidneck Island in Middletown at the Bennies, you know, the famous landmark there. So one of the kind of another key piece of context there is right now, you know, we've boosted about 44% of Rhode Islanders that are eligible. So we know there's about 340,000 that are eligible today. We want to expand that capacity as quickly as we can to get them boosted.
And the second part, if I might, Governor, as far as activating the National Guard, is that a matter of money? You lack the funding to bring them on board, to put them in the hospitals, or have the hospitals resisted bringing Guards people into their facilities?
No, we're working our way through that right now. You know, we want to make sure that we know if we activate, that we do it in a way that there's reimbursement coming. That's not delaying the conversation. I think what it is that we're reacting very quickly to a moving target. And so everything is on the table. And as you can see, a great deal has happened even since last week when we announced the mask protocols, right? So, and we're certainly managing that as well. So we got everything on the table, and any resource that we can possibly use that makes sense logistically. The finance really are not immaterial to it, to tell you the truth. It's logistically, if it works, to create higher levels of safety as we, work through this this unknown territory, right? As I've mentioned, and Tom just mentioned, we're up to 42. You said 42% of the eligible people on the boosters. We got the National Guard working on that right now. So they're activated to the degree that we believe is in the best interest of the state of Rhode Island, and really finances is not going to deter us from providing services that make sense. Yeah, it could go there, but again, just from a logistic point of view, many of the healthcare workers that might be in the National Guard are working in the healthcare system. So that if you actually pull them from one site to another site, you gotta zero-sum game there, right? So I think that we gotta, focus and analyze what the value is of that personnel, and we're in the process of doing that right now. As I mentioned, I did ask the general how I should answer that question today, about 2 hours ago. So that's how everything's on the table.
Right over here.
Now, a question for Tom. I know you talked a lot about testing, very thorough response, but there's some people who are still waiting for those turnaround times in terms of results. Some are even pushing a week. That we received some messages from people. I guess what would you say to those people who are, very anxiously waiting for those results, especially with the holidays this week?
Yeah, absolutely. So what I would say is it's important to make sure that we're kind of leveraging the right test for the right time. So if you're asymptomatic and just want to check and see that extra layer of caution before you go visit someone, get a rapid test. You'll get a quick turnaround there. We know for many instances, though, perhaps to return to school or return to work, you need that PCR result. We are trying to work through that backlog as quickly as we possibly can, but we really need these additional labs before we can do that, and that's going to take us a couple of weeks. So we're getting some additional capacity out of state that should make our program more resilient. I think the other piece here too is right now it's about 83% of results that are coming in under 3 days, but we know there are far too many Rhode Islanders that are stretching out to that 4 to 5. So now, especially where we are with Omicron, if you're unsure, if you're symptomatic, reassess your risk and think about what you're going to do, over the holidays here. The good news is if you're symptomatic and you're getting tested, you're also getting, a rapid result that should give you some kind of indication right away.
Any ballpark as to when those labs will be available? I know you said a few weeks. I don't know if you have it.
I'm doing everything I can to get them to start accepting samples. I would love to see it this week. I think, by the beginning of January, first week in January, we're going to see our turnaround times come down. I'm working 24 hours a day to make that happen sooner.
Thank you, John.
Governor, good afternoon. Merry Christmas to you, the Lieutenant Governor, and Mr. McCarthy. Governor McKee, Governor Baker today announced in Massachusetts it's a mask advisory. And Connecticut, they also have the mask advisory. So Rhode Island is an outlier where the northern part of our state has a mask mandate, and they feel that their workers have to act as like the mask or vax police. Why is it that Massachusetts has a mask advisory, but you have the mandate?
Well, every state has its own circumstances. I think that it was pretty clear that at that press conference the other day that there was the hospitals to every single one of them. I was on a call this weekend about other issues that the hospitals are asking us to consider. So the hospitals were in unison asking for that, as well as the Medical Association in the state of Rhode Island. I think that we've compromised a good spot that time will tell, but I think that I feel bad that the Georgetown game was canceled because of the COVID issue for tomorrow night. I was very hopeful that we would show that, as working with the dunk, that the people in attendance there would be wearing masks. So Look, it's a 30-day strategy. It's going to expire on, if I don't continue it on January 18th. I don't think we're asking anything over and above what is for in the best interest of the state of Rhode Island. And we'll work with those, in those few instances where they believe that they have customers that are not behaving properly. We've asked everybody to post up, what their each business or each facility is calling on, whether they're looking at vaccine only, like the PPAC has, or whether they have a strategy. These are under 250, I think, that you're talking about. Or whether they're doing a combination. Look, if you're vaccinated, you can come in and you can wear a mask, not wear a mask. That's pretty flexible. If you're unvaccinated, we're asking you to step up again during this time frame as we try to get on top of what's going to happen on the variant. Right now, we're fortunate, as Tom said. I think that one coming here today, I think that the number was three of the new variant in the state of Rhode Island. I do think that our vaccinations and our behavior has put Rhode Island in a spot where it has led the country during Delta on the key pieces that are important to the health of the state of Rhode Island. And I think that what's in front of what's being asked right now of our local businesses has given them the flexibility to overcome many of the issues that I was fully aware as Lieutenant Governor that was restricting them to a level where they couldn't operate. So our gyms, our dance studios, and others that are in that category, there's a great deal of flexibility. So all I can say is, look, you're not going to satisfy the two extremes that want us to shut down the economy, or the extreme that just have us do nothing. So I think that we've had a good medium here, and we're going to work our way through to accommodate as many of the issues that might come up over the next couple of weeks. We're available. If something comes up, we want to hear from them, and if we can kind of smooth that over, we will.
We're going to try to get to everyone in these last couple of minutes. Alexa? Yep, so AARP Rhode Island sent you a letter asking for the booster rollout to prioritize older adults. Did you receive the letter, either the governor or Tom? And can you tell us kind of how the booster rollout is doing in terms of vulnerable
Well, I'll make my
residents?
quick comment on that, and I'll let Tom verify that, because there's a question I asked him this morning. There's no need to prioritize anyone. We have the inventory. We got the ability to get people vaccinated. We need to build out the capacity, as Tom has said. So I haven't directly read that letter, but I would say that the AARP, look, there's enough supply to have everyone in the state of Rhode Island who is is eligible, based on the standards of the fully vaccinated, to get vaccinated as quickly as they can. So there's no need to prioritize, and I think the question is a good question, because we did prioritize last year at this time into age groups, into other factors, but I'll let Tom finish that up. But I think that he reinforced, that's actually the question I asked you about 2 hours ago, Tom. I think the exact same question, so.
That's right, Governor. Thank you. Yeah, so with regards to, last year, we didn't have enough vaccine in the state. I think the big thing right now is we have been ordering above what our authorization was through the federal government. They've been great partners, so we're getting about double each week. Now we're just trying to make sure we have enough people to actually do the vaccinations. But with regards to older Rhode Islanders, throughout the response, we've always prioritized our most vulnerable. We know some of our older Rhode Islanders kind of fall in that category. They were the first that were eligible for the booster. We held clinics at all of our nursing homes, long-term care facilities, and congregate care. And then last week, we called every single one where they had lower vaccination rates and offered to come out and do clinics again. So ready and willing to continue to do that.
And I just add, too, as a point of information for the people listening, that that's one of the reasons that we've really now reached out, reactivated municipal leaders and municipal EMTs and firefighters in a way where seniors will feel comfortable in many ways getting vaccinated close to their home. So we're going to make that as available as can. Right now, we would go to vaccinateri.org. Is that the site, Tom?
That's right.
Vaccinateri.org, and they can create an appointment in the options that are available.
This is a question probably best directed to Tom McCarthy. I understand that the state and the federal government are both making a big push to send out at-home tests, rapid antigen tests, and so forth. But I've been hearing from a number of medical professionals, including at least one who had a senior role with the state in the past, expressing concern that we are not really aware of the scope of the problem, suggesting the possibility that there may be between 2 and 10 times as many people with active COVID infections as we've been able to count and measure. And I can't obviously vouch for that, but my question is, do we have a concern that as we change the mode of testing, we go more toward rapid antigen tests, at-home tests, at-business tests, and so on, that we will lose the ability to measure the rate spread of infection and even to detect things like new variants or the prevalence of variants?
Yeah, that's a great question. And, this is something that the team's been looking at for some time because we knew at-home tests, are going to be a part of the strategy moving forward. It was kind of a matter of when. And I think some of the initial concern was exactly, that point, having a very clear sense of who was actually positive, and especially when we're talking about mitigating spread, ensuring they're isolating and quarantining, and quickly connecting them with treatment. I think as things have evolved, we have a couple of different opportunities here. One is ensuring that there's accessibility. We're running into this right now. There's a hard and fast limit on how many people you can test at our physical infrastructure. So having a test is better than no test, far and away. The other piece is making sure that process is easy and seamless for people that do test positive. If you test negative, we'd love to know too, to help us understand the bigger picture, but make them report it in. And then also working with schools, businesses, clubs, sports organizations to have testing programs on their locations. And we have some fantastic partners in the business space. So with all of this and a fantastic data team, both at the state and in partnership with Brown, we're confident that we'll still have a really robust surveillance program to help us understand where is the virus, what is it doing, and what do we need to do to stay in front of it.
Do you have any concerns about the accuracy of rapid antigen tests relative to PCR tests? In particular, are you confident that rapid antigen tests will not produce an unacceptable level of false negative results for people who are particularly symptomatic?
Sure, that's another great question. And again, the PCR is the gold standard, right? But in the appropriate settings, the rapid antigen is a great tool as well. And again, a test is better than no test. There's a difference if you're symptomatic. If it's positive, you can be fairly confident that that result is positive. That's why in that workflow today at our testing sites, if you're symptomatic, you'll get a rapid, but you also get a confirmatory PCR. When we're talking about someone that's asymptomatic and you're just trying to see if it's safe for you to gather, things like that, rapid antigen's a great tool, and a way that you can achieve a higher accuracy is, more than one test over a couple of days here. So I think it's important for us to not let perfection get in the way. We need to really start integrating all of the different tools through that layered approach to make sure, we have the most effective approach.
Okay, Ray over here, and then we'll have the last question.
Okay, it sounds so beautiful what you guys are saying here, but it's not contact tracing. For the past 3 weeks, my family is getting sick with COVID. All my cousins got COVID. Nobody got a phone call. What are we going to do for contact tracing? Second, with the Spanish translation, you got to speak in Spanish, Sabina, because the community is getting affected. I mean, you can do all the tests you want. It's not going to work if you don't tell people somebody tests positive. Contact tracing worked before. You had to activate it. I'm still waiting for 10 days for an answer from the Department of Health, from the governor's office, and nobody's saying anything. What's going on?
Yeah, so we have a very robust contact tracing team. They've continued just as they have throughout the pandemic. I think another thing, though, again, as we're talking about the number of cases that we're seeing today, is that we have to prioritize. So when we're talking about the very detailed case investigations, it's in those at-risk settings, those Rhode Islanders that are at higher risk because they have underlying conditions or they're unvaccinated. But if you test positive, because you get a notification from us on your test result, and then you're followed up with by a contact tracer. But I'd love to catch up with you after and understand specifically what instance you're talking about.
Well, one of my family members passed last week, and the other one is in the hospital, in intensive care unit, and nobody got a call.
Okay.
He's sick.
Ray, let's have you follow up with the Department of Health.
I'm still waiting for you guys for that. Sabina, say something in Spanish. Because the community is waiting for
So-
an answer.
Yes, I just want to, we normally have translation available on this press conference, so it's being translated as they speak. Normally, it's happening,
Say
so
something
I
in
can.
Spanish. I don't say that
No,
you-
I don't mind saying something in Spanish, and I think that I bring that, but I just wanted to let you know that translation is provided for this conference. Queremos recordarle a toda la comunidad que el COVID está aquí. Tenemos dos variantes que son muy fuertes, el Delta y el Omicron. Queremos asegurarnos que usted tome las precauciones necesarias para que su familia esté segura. Si usted tiene algún síntoma, se siente que tiene algún síntoma que cree que sea una gripe, no tome el riesgo de llevarlo a sus familiares. Así que quédese mejor en su casa, hágase una prueba rápida para saber si es COVID, sí o no. Y si aún así la prueba rápida y usted tiene síntomas, es negativa, evite el encontrarse con sus familias en estos días y evitar que pueda tal vez causar que alguien en su familia se contagie de COVID.
Governor, it was a wonderful, actually a blessed day last week when the state of Rhode Island finally came to the table with significant funds to help the homeless. And of course, when you hear about the expansion of programs like RIHEAP and this new proposed water bill for those less fortunate, one can only smile that their needs are being attended to. But for those folks in the middle class who did not seek the warm embrace of state government, for whom there seems to be never any consequences, or took the dreadful step of having a private business, who have now become the front line, as Mr. Petro said, the arbiters of all things on a chaotic, confusing Byzantine mask semi-mandate. What are you doing for them? And because they're the ones that are actually getting squeezed without any sort of assistance by high housing costs. They're the ones who have no one to go to when their small businesses are being crushed. They have nowhere to go, and yet the state government continues to hold on to $1 billion, which I can only assume they're figuring out who the privileged few are going to get doled out to. What is the government going to do to lighten up on folks?
Yes, so first of all, we haven't seen the results of the way that the public and the business community has responded in a very positive way throughout this whole process. There's no one who's advocated more for the small businesses during the time I was lieutenant governor and continue to do so. $30 million we found that went out to our small businesses in the spring. The request right now shows, I think, almost $35 million that's going to go into the business community, small business community, once the General Assembly approves. So we will continue to assist the small businesses, including we're preparing now, which I'm headed to a 2-hour budget, daily budget review, where we will have an article for the small business friendliness that the state has never seen before, and we'll continue to do our work and continue to work with those who are willing to work with us. And I think you're going to be surprised the fact that there is buy-in here, because, as I said, there's, in my fantasy basketball, which I still work with the kids that I coached years ago, I had 7 players that couldn't play this weekend because of postponed games. The fact of the matter is that that around the country, and to a lesser degree in Rhode Island right now, we're getting impacted by the surge of the COVID. And you can just see that, as I mentioned, with the Georgetown cancellation, the Brown URI game. It's front and center. We're dealing with something that is, it's very, very important. The advice my wife gave me when I went to an event on Saturday night was be careful. There's a virus out there. And that message is one that we take very seriously, and that's why we're here today to bring Tom forward and the work that is being done to address the issue. And that issue in terms of the EO that I signed relative to the masking is a good possibility, compromise to help our small businesses. And it clearly states in the EO that we took in consideration the small business community. We'll continue to do that.